Child abuse refers to any action or failure to act by a parent, caregiver, or another person that causes harm, potential harm, or the threat of harm to a child. It can take various forms, including 1. Physical abuse, inflicting physical harm through actions like hitting, kicking, burning, or otherwise causing bodily injury. 2. Emotional or psychological abuse, behaviors that harm a child's self-esteem or emotional well-being, such as constant criticism, humiliation, or rejection. 3. Sexual abuse, involving a child in sexual activities, including exposing them to sexual materials or forcing them to participate in acts they cannot understand or consent to. 4. Neglect, failing to provide basic needs like food, shelter, clothing, medical care, or supervision. Child abuse can have long-lasting effects on a child's physical, emotional, and mental health. It is a serious issue that should be reported to authorities or child protection services if suspected. These effects can vary depending on the type, severity, and duration of the abuse. Common impacts include emotional and psychological effects. Low self-esteem, constant criticism or rejection can make children feel unworthy or unloved. Anxiety and depression, children may experience persistent sadness, fear, or feelings of hopelessness. Post-traumatic stress disorder, PTSD, repeated trauma can lead to flashbacks, nightmares, and hypervigilance. Difficulty trusting others, abuse often damages a child's ability to form healthy relationships. Self-harm or suicidal tendencies, some children may resort to self-injury or have thoughts of ending their lives. Behavioral effects, aggression or violence, some children may act out their feelings through anger or hostility. Substance abuse, affected children may turn to drugs or alcohol to cope with emotional pain. Risky behaviors, abuse can lead to risky sexual behavior or other dangerous activities. Difficulty in school, poor concentration, frequent absences, or lower academic performance may result. Physical health effects, injuries or chronic pain. Physical abuse may leave visible injuries or long-term physical conditions. Developmental delays, chronic neglect can impact physical and cognitive development. Weakened immune system, stress from abuse can impair the body's ability to fight off illnesses. Social effects, isolation, children may withdraw from peers or have difficulty maintaining friendships. Attachment issues, abuse, especially in early years, can lead to difficulty forming secure attachments. Long-term effects, abuse in childhood can have lasting effects into adulthood, including increased risk of mental health disorders. Difficulty maintaining healthy relationships. Higher likelihood of perpetuating cycles of abuse.